Hi, my friends. My name is Dr. Sayyeda Amna Mahmood. So, today I have select the topic between the normal pregnancy and the abnormal launching of the gestational sacs, which is the outcome of the threatened abortion or the end of the miscarriages. So, now we have to start to see the first slide, which I have to select for you for the normal gestational sac in the endometrial cavity with launching of the normal decidual reaction, and this is the normal fetus. But you have to see the differentiation of the other side, which you have to see the thickened wall yolk sac, and is some of the discordance in between the immunocavity and the chorionicity. So this is the embryo. So what is we have to be see in the gestational sac when the ladies are coming in for to due the date for more than 1 week or 2 weeks for two positive pregnancy tests. So what we are recommended for around the 4 weeks to the menstruation days, and 4 weeks plus 4 days for starting for the to see the thickening of the endometrium in the ultrasound related to the giving the beta hcg levels, which are more than 1000 and 2000. So we have to think about the positive pregnancy test. Now, the pregnancy is a launching of the gestational sac, which we have to be see around 2 millimeter in diameter and increased in size about the 5 to 6 millimeter around the 5 weeks. So the benefit of the transvaginal ultrasound, so we recommended most of the early pregnancy in the transvaginal ultrasound around the 5 to 7 weeks. So for the correct of the dating, we know first we have to see the location, we have to see the dating around the 10 to 15%. The sometime is the gestational sac are at the abnormal places like the eccentric pregnancy, or the uterus have some the mallinear abnormalities like the bicornate uterus, septated uterus, which is we have to discuss in the next topic, which is very important for the ectopic pregnancies and the eccentric pregnancy. Inshallah, I will make the next in the next few months or next week. So, and we exclude the launching of the gestational sac around to the cesarean scar and ectopic pregnancy, and the identification of the chorionicity and amnionicity like the multiple gestational sac and their relationship. So now the female is pregnant, and she has a heartbeat which positive on the TVS ultrasound. So how can we exclude from the normal pregnancy to the abnormal pregnancies? Abnormal pregnancy, the heartbeat in between the 120 to 180 heartbeat, and which if the baby is less than that 120, like around 90, 50, 45 and 75 related to the fetal bradycardia. So this is indicates sometime the abnormal fetuses or abnormal pregnancy, like relationship of the genetic or the chromosomal abnormality. We have to be then offer for the NIPT in future for to exclude the trisomy 21, 18 and 13 if pregnancies continue with the fetal bradycardia. Now we have to come to the topic again for the gestational sac. So we see the endometrium, like this is the decidual reaction around the gestational sac, and this is the fetus. So this is the normal pregnancy, but you see here this is the decidual reaction, but the size of gestational sac compared to the fetus is not normal. The yolk sac look like a big. So this is also the sign of the maybe the pregnancy will be outcome is not good, or maybe it is a threatened abortion is going to the genetic abnormality, or maybe it's going from the chromosomal abnormal fetuses. So Now, what is the finding? We have to find to see the regular wall of the gestational sac in the normal pregnancy with relationship of the embryo. You see the another side, there is an irregular wall of the gestational sac, but the embryo is fine, but the wall and the residual reaction is not not proper. So this is also the sign of the weak pregnancy, and it is we have to be guide the patient is might be is a outcome is not good, like it is end on the threatened abortion, and then threatened abortion is come out then into the miscarriage might be. So now the importance of the yolk sac. Why the yolk sac is so important? The yolk sac is like a supply of the nutrients to the baby. So the importance of the yolk sac is to there is a supply of the nutrition. So you see the abnormal pregnancy, there is an echogenic yolk sac. Sometimes the abnormal pregnancy have the very big yolk sac, is more than 7 millimeters. So this is also the indication of this baby when this fetus cannot be continue, have some genetic issues or the chromosomal abnormalities. So these are the findings of the comparison with the normal pregnancy to the abnormal pregnancy or the early sign of the pregnancy loss. Sometimes we have a around the gestational sac, a subamniotic collection or subchorionic hematoma, which is also indicate of the threatened abortion. And we have to be see the embryo, which is size of the embryo is not cooperating as compared to the size of the gestational sac. So sometime it will be also indicate the threaten or the miscarriages. This is also one very weak sign of the amniotic cavity is comparison to the embryo, which is also indicate the some chromosomal abnormality. Now we have to discuss about the embryonic pregnancy. Sometimes the pregnancy and the pregnancy hormones are growing up and up from the fold, but the embryo is have no yolk sac and the fetus, like the fetal pole. So this pregnancy is also visibilized ovum or the embryonic pregnancy, which is also and on the miscarriages and misabortion. Now the gestational sac position is also is very important. The location of gestational sac is always in the mid cavity. You see the cavity always within the ultrasound. Don't see is in any other the gestational sac in the mid cavity or is in the lower side of the cervix, relationship of the bladder. So this is very harmful pregnancy if the female have some previous cesarean scars and then any of the DNC or any other procedures. So this is a very dangerous, and this is the pregnancy is also the cervical pregnancy or the ectopic, this pregnancy coming the ectopic location, ectopic pregnancy. So another of the sign of the sliding, which is the early sign of the miscarriage, is if you are doing the transvaginal ultrasound. So what is the sliding effect? When we are pushing the transvaginal probe, so the sac is moving in the cavity. So in the cavity sac is moving, so it means it is a sliding gestational sac, and it is a sign of miscarriage or it is early abortion. Thank you so much. Hope you all are enjoy this video and to understand about the early pregnancy losses as compared to the normal pregnancy. Thank you.